I'll go over the data, a couple timely topics, and then we'll take questions. Unfortunately, we lost two members of the community over the weekend. 70-year-old male, Caucasian male, and a 71-year-old African-American male. We've lost 702 of our residents in the pandemic, so certainly thinking about them, their families, just very sad. Our positive rate, stable, 1.4 and change, can round up to 1.5. Our daily percentage was 1.3, so a little bit lower than our 7-day average. So hopefully that's a new trend. It looks like that's starting to be the trend in other parts of the state now. So hopefully we'll start to see that as well, although we've been lower than the rest of the state for about 3 months. Overall, 42 new cases today. We've had 36,469 positive confirmed cases of COVID. Our active cases are 635. We transferred out about 6 cases from over the weekend. So on the weekend, I report via social media what the cases were. So we had 6 more reported than actuals. So that's nice too. But yeah, 635 active cases. Hospitalizations, 54 are in the hospital right now. 6 of our neighbors are in the ICU, so please keep them in your thoughts and your prayers. Usually Mondays, you don't see a lot of discharges from the hospital, so Thursday we'll see where this number goes. Hopefully it gets back down in the 40s, but certainly still people getting sick on a daily basis with the virus. So that's something that I think we need to be cognizant of, is we're turning the corner on this pandemic. I think we're inching towards the red zone, but we still got work to do. From a vaccination standpoint, we're over 240,000 of our residents have been vaccinated. It's essentially over 52%. Eligibility standpoint, we're looking at a better number, about 66% today of those who are eligible. To get to that 70% of eligibility, the 70% vaccinated who are eligible, right? That's the first one we have to go to, because there are at least 100,000 people in this county that aren't eligible to get a shot yet. We need about another 10 to 13,000 people to get the shot. So that doesn't sound like a lot, but that's going to be a challenge. But I think we'll get there. What are we doing? Tomorrow we have pop-up clinics at the Northside Learning Center. We're studying the zip codes where the participation rates are much less than others, and we're going into those communities with pop-up clinics. So this will help us with the 13206 and 13208 zip code. We have a pop-up clinic as well tomorrow at the Cecil Community Center in the city of Syracuse on West Seneca Turnpike in the Valley. From 9 to 12, walk-ups are welcome. Prefer that the walk-ups come in at 11 o'clock to 12, but certainly if not, if that doesn't work for your schedule, just come on in whenever. That will help us target the 13205 and 13207 zip code. We will be on Wednesday at a pop-up clinic at the Mattydale Fire Department from 9 a.m. to 12. That is with the J&J shot. And certainly that will help us with the 13211 zip code, which is also lagging. On Thursday morning at Hillrom, we will be doing a clinic that will support the business, but also the community as well. All these other shots, by the way, have been Johnson & Johnson. Thursday morning, Hillrom, Skaneateles Falls, 9 to 12, that will be Moderna. The Skaneateles Falls zip code 13153 is also lagging, and at the same time we'll be able to get employees of Hillrom. And then on Friday we will be at a pop-up clinic. We have 2 clinics on Friday. We will be at the Cicero American Legion for a J&J shot, working with our partners at the Legion. We've done testing at the Legion. We've had great cooperation there. And then we will be at the On Center here on Friday with the J&J shot, and walk-ups again will be welcome as well. So we're taking the data, we're going out and getting into the communities specifically that are lagging. with these pop-up clinics. That's probably where we have the most room for growth as far as vaccine participation as well. And so we'll keep everybody posted on the progress we're doing. We're already starting our schedule for next week, which will go in and attack some of these other zip codes. We'll be back in 13204. We'll figure out the right ways to get into 13203, 13210, and then we'll get more data. Some of our partners, for example, were Walgreens partnered in Elbridge, where you have Jordan and Memphis, part of that community. They have been lagging, but they have a clinic this week with Walgreens. So we're there, we'll assess at the end of the week where we are to get things. On the low side, we have participation in zip codes. This data is from April 23rd, so it's a little dated. But the 13204 was the worst zip code as far as participating, 23.9%. And Fayetteville 13066 was the best at 56%. So there's some things have changed since then. We've had some pop-up clinics in these communities, which will help our numbers a little bit. But we're going into these other communities specifically to try to make the distribution point that much easier. Reminder on asymptomatic testing. We're still doing it 4 days a week at the On Center. Please get a test. Our testing strategy is why our community's done better than others, in my humble opinion. So please continue to take advantage of that. Community testing sites. Tomorrow we're at the Syracuse Northeast Community Center in the Fayetteville Village Hall. And then on Thursday we will be at the East Syracuse Village Hall. Tomorrow is a big day. Tomorrow is opening day with the Syracuse Mets. The community's new $26 million renovated stadium is ready to be enjoyed by all. So please support the Syracuse Mets. I worked on my opening pitch, by the way, over the weekend. It's very difficult with double vision. Dr. Gupta told me this could be a problem, but when you are out there on the mound, so I saw quite a few, but I was focused in on accuracy, not speed, and I think I got the job done. You'll see. But free asymptomatic testing inside the parking lot of NBT Bank Stadium. This is a partnership with the Mets that we will continue to do. Speaking of that, the governor came out today with some evolving guidance with Northeast states. We got to dive into this guidance and how it impacts some of the questions people have. You had many situations where there's capacity constraints removed, but not physical distancing. In many of these situations, that won't lead to any more capacity. So you can say you're no constraints, but if you still have to be 6 feet apart in seats, you're stuck at a certain level of capacity. I do think that part of the guidance we're getting clarification is if you're vaccinated, then you don't need to be 6 feet apart with some of these venues, et cetera, or if you test negative. These are all things we got to work through. So there's a lot of different applications to our community. We're excited about the fact that we're inching our way forward to getting parts of our community reopened for the spring and summer. But we need to better understand these. I know we're going to get a lot of questions, so we'll probably talk more about it on Thursday. Finally, I've been asked all day about this, so I'll discuss it here. I did receive a proposal a short time ago from the sheriff related to body cameras. We'll forward the legislation to the legislature for tomorrow. Probably be about $600,000. What we have in that $600,000 is as follows. There will be body camera money for a year, for the first year, for the cameras for the police division. Also, the sheriff has asked for cameras for his vehicles. We will support that, and then we will have some personnel funds in there to help administer the program. In my communications with the sheriff, there is a new ask that I'm unfamiliar with, so I'm going to refer that ask to the Public Safety Committee. That ask is for body cameras for correction officers and civil officers. Whether we would be the first department to do this or not, I don't know the answer to that. It's a pretty significant ask and the first time we've heard it. So we will move forward with the Test and True body camera program with our police officers. That will get approved by the legislature tomorrow. And then we'll begin a RFP process, for probably a short, quick turnaround RFP process for the equipment, purchase the equipment. And then the sheriff can move forward with that program quickly. And I will ask the legislature to take up in Public Safety Committee the concepts about getting more cameras for individuals in the jails, in the corrections departments. Again, in these facilities, we have cameras pretty much everywhere. So again, this is something that probably needs a little bit more study and certainly should not slow down the implementation of the police division getting body cameras. So very happy with the work that has been done by our team and the sheriff's team and the district attorney's team to get this done and move this forward. Questions?
The police division, do you know how many deputies that is?
224.
And 600,000 should cover that for 1 year?
Yes, we'll cover, it will cover that. It will cover vehicle cameras, and it will cover personnel to administer the program.
What's the reasoning for asking for the jails, the corrections officers to have cameras and the civil officers to have cameras?
Yeah, it's a little vague. You know, I think they're talking about risk management is the concept, something we believe in. But again, we've never heard of this before from the sheriff, this was a, remember in the communications last week, the sheriff was talking about how he had a pilot program from 2017 for the road patrol deputies, his police division. There was no pilot program or ever talked about for this. So it's a new ask. That doesn't mean that the answer is no. It means that for this type of proper ask, we're not going to ask for a waiver item from the legislature, right? So this will go forward. It needs to be vetted. Questions need to be asked. The sheriffs and their team need to provide good answers for the type of investment they're asking for.
If it's 600,000 for this year, what do you foresee as the ongoing annual cost?
Yeah, I think that's probably a fair number, Tim, for the next 5 years. It's essentially most of the way that these the vendors procure these is 5-year contracts. So I think out of that 600, again, we got personnel money in there as well. So I think, you know, when you look at your police body camera program, that's probably the yearly cost with a 5-year commitment, obviously with a vendor. Obviously, our commitment is this is standard protocol moving forward.
Would you pay 600,000 times 5 in advance for 5 years?
No. Yeah, you wouldn't appropriate that. You just put it in the budget each year.
Is that one full-time position?
No, probably we're looking at, so the SPD, my understanding, uses 2 people. The sheriff asked for 4, but the sheriff asked for 4 people for an expanded program. Remember, in his ask, he's asking for corrections as well. So essentially, the way we look at this is by the time this is probably ready to get going, that there's probably enough personnel money there for 2 to 3 people.
On the restaurants and the capacity limit for places like restaurants, we've already heard from some owners just in the Syracuse area in the restaurant community the exact kind of concerns that you brought up. So you said Thursday you're going to learn more?
Yeah, we're gonna study the guidance. I had a call earlier with the governor's council and other county executives, and we went through some of these changes. I think as probably either the governor was doing it at the same time at his briefing or shortly thereafter. And there just wasn't enough time to get all the questions in. Obviously, we think part of this is that some of these new regulations will not be regulations if you're vaccinated and or test negative for, you know, with a test for some of these operations. But yeah, if you look at restaurants, if you have so much space, if you're saying you can be open 100%, but you still got to be 6 feet, that's still a restriction, right? And whether or not that restriction is merited or not, that's fine, right? That can be debated. But you're really not, you have to find that balance for some of these things. You're really not doing anything to open up these businesses more if certain restrictions still require. Our ballpark, there's 6 feet is 6 feet, there's only so much we can fit, right? So many people we can fit there outdoors. Think about this though too. Outdoors, vaccinated and or test negative, and we still got some of these constraints, a little overkill.
You've always tried to use data to tell a story as a way to try to figure out the problem. Do you see a pattern in the lowest performing zip codes when it comes to vaccines and why those areas are low performing?
Yeah, I think some of it's, I think, distribution method, and so we're going to try. I hope that's a large part of it, Andrew, because we can fix that easily. You know, some of it certainly is hesitancy, and that's a little bit harder to fix, right? So what we'll do is we'll go through. Dr. Gupta and her team have done a great job of putting together teams, and we'll go through into these communities, and we won't just do it once, right? We'll go through a couple times, see how we do, and then I think we're going to need to, whether it's you know, town hall meetings or whatnot, we're going to need to get into these neighborhoods and talk about this, just because there's room for growth here. We must do better than some of these data points, and it's not just a city issue at this point. There's rural communities that are lagging, you know, 20% from other suburban communities.
What was the response in Fabius last Friday?
It wasn't bad. I mean, one of our smallest towns, I think we had 80 or 90 people that came for the J&J shot. So, again, we used to always look for 250 people at a pop-up. That's not where we are anymore. But it was a great response. It was a great little clinic, and the people of Fabius were very happy we were there, and we may go back. But it was good. That's not updated in these numbers.
Am I right that 13204 is the west side of the city of Syracuse, down south a little from there?
Tipperary Hill, near West Side.
Yeah, I mean, do you see a reason that neighborhood would either be hesitant or
Sure.
feel not accessible to the previous offering?
Yeah, you have traditional barriers, right? One year, 13204. For those of you who are younger, Andrew, our 20-year-olds and 30-year-olds they're just a little behind, right? So if you look at that's a big demographic of that neighborhood. When you look at our near west side, one of our poorest areas, you run into other types of barriers to anything, right? Transportation's a barrier. So us going into that neighborhood, we've done it already. We're likely to do it again next week. I think we were talking about Fowler High School. These are things that we understand that distribution, you know, with the virus, when this all starts, right, epidemiologists don't care where you live. The idea is just get as many shots in arms as you can so you can take away hosts for the virus to feed on. At this point, we're in the process where you got to go micro-target, and you got to make sure that there's complete access to this vaccine from an equity standpoint. And we've done better than that, you know, than most communities, and we're going to continue to do that. But at some point, you're going to have zip codes where participation just won't be as high.
And your best zip code was what?
13066.
On a related topic, there's a story in the New York Times today that says that it's unlikely, according to experts, that the U.S. will reach herd immunity. Obviously, for many Americans, that's kind of been the goal that everyone's trying to do, herd immunity. What's the situation here in Onondaga County? What have you heard from your experts? Is this a specific concern of yours?
Yeah, I think it's early, right? I think I saw the article, and certainly Dr. McMahon's opinion is that there's still a shot at herd immunity. We'll find out soon. Our data. So if you look at our data, it's just crystal clear that your demos over 60 that have been vaccinated at higher rates just aren't getting this virus. It's, you know, a case or two a day, and then. So then you kind of figure out who are they that are still getting it. Most of them haven't been vaccinated, or you'll have some randomness at some time in the future. At some point, somebody who's been vaccinated will get the virus, right? But you track it, just like everything we've done this whole process. We go into where the problem is, and we try to really focus in on vaccinating. The virus is clever. The virus is going after younger hosts now, right? It's going into the schools. And not transmitting in the schools, but through those age groups. So that 12 to 15-year-old age group is the one that I've made the bet that let us vaccinate that group, and I think this thing kind of falls apart because your 12 to 15-year-old is social. I have a 12 to 15-year-old. He's very social. He goes and sees his grandparents. He sees his aunts, his uncles. He's playing with multiple friends. He's going to school. If they have that, that's a good little person who can get out there and spread this, right? So once we can get them vaccinated, guess who else gets it? Your little brothers and sisters get it then. So I think once we get through that, we'll really know, at least locally, where things stand. Our data has been rock solid. We have been between 1.3 and 1.5% for a positive rate for over a month. And so one could argue we've already developed some sort of immunity within certain age demographics. I would suggest we have.
Some time has gone by since you announced the mental health funding from the county, the $5.5 million that school districts can, they can use that in different capacities. I've talked to some superintendents. Communities are going to the polls to vote on school budgets. A lot of schools are making that investment, whether it's through, eventually the American Rescue Plan funds or, working with the county to use whatever they can, whether it's to hire a counselor or something. Have you gotten a good response from schools in the county, and are there schools that have not reached out to you yet?
No, we've talked to all districts. We'll have the three-tiered approach for all districts. You'll have your, essentially our partners who are doing various levels of social work, developing and helping to identify individuals that are having issues. Once those individuals are identified, you'll then see a second level of support for family support, right? And then that will be student families having some sort of support, professional support. For those that are in severe situations, we have full-blown mental health clinics that we'll have in each district. So this will be fully implemented going into the next school year.
How many school districts, as of right now, would you say are in that full-blown mental health clinic need group?
All of them. I think every single district needs this, and we anticipate every district will do this. The isolation has had a severe impact on our kids at every demographic. The little ones do a little bit better because a lot of them don't know much different than what they've just lived through. So, but if you look at our teens, you look at even our kids who are in college, our adults, what this thing's done to us, everybody could use the support. So we anticipate that we'll have mental health clinics in every district.
And every district in the county you have heard from?
Correct. Correct.
What's the on-center schedule like right now? Are you down to one a day in the coming weeks, or not quite that down yet?
Yeah, right now we still have a couple second clinics that are from larger weeks that we're working through. But yeah, I mean, on-center will be kind of home base still. When we have a pop-up fall through, we can always reschedule. We had one that we are going to do Friday. It kind of just didn't come together, so we put the on-center J&J clinic quickly on the table. So certainly at some point this facility, will probably just be all pop-ups. We always could activate it again. At some point, hopefully this facility is hosting events again.
Last week you talked about incentives for people maybe getting the vaccine. Have you had any more conversations about that at all?
What was that?
You talked about incentives for people getting the
Yeah,
vaccine.
yeah. So, you guys are, okay. You guys are on this.
Of course.
Put the pressure on us. No, we have. We're having some discussions about creative things we can do to incentivize participation, especially in our younger demographics. And so hopefully, maybe, I can't make any promises because I'm not the creative member of the team. So maybe we'll have something to talk about on Thursday.
Also, we've heard from parents that on social media there's been some misinformation or rumors going around about the vaccine. Does the county have any plans at all to have like an information session or anything like that?
Yeah, Dr. Gupta, and we've talked about kind of these sessions, whether and again it's to deal with the hesitancy issue and or a lot of stuff's out there, right? And a lot of people hear something that they think sounds pretty good and they stick with it even if it's wrong. And so you got to try to address that the best you can, understanding that if you win over one heart and mind to your side, you had a good day. So, we feel it now. Things have slowed down. We feel it. We're pretty close to getting to 70% of the eligible population, which should be our goal, and then we keep going from there. And again, our goal overall is to make sure that any human being in this county that wants a shot gets a shot, and our job's not done till that's done.
And the best way to kind of go about this is word of mouth. You know, someone else tells someone else that they got the shot and it was good. How do you kind of tell someone or go about the approach if someone to have the conversation with someone who might be hesitant? What would your message to them be?
Yeah, so this is, from a credible messenger standpoint, to your point, I believe you are one now as well. So you need to be with your friends. And this is, for everything that we don't like about this pandemic, I think it's going to be pretty clear in the coming days as some of these regulations about reopening the economy fully come out. You know, the vaccination is kind of the tool to do that. I know from the public health side with what we see, we know it is. But for those who maybe don't buy the pandemic the way, and they have their own opinions on the pandemic, this is just kind of what it is. If you're vaccinated, it's going to be easier to do things than if you're not. Whether it's right, wrong, or different, that can be debated, but that's where this looks like it's going.
Will tomorrow's baseball game be the largest gathering in county in 14 months?
Legal gathering, I'm sure. Yeah. I'm sure there's a couple illegals during the pandemic that might have rivaled it.
Yeah, that's true, but I mean, seriously, you think, I mean, legally speaking, official events, that should be?
Yeah, I think they've sold out. I'm assuming that they'll be pretty close. It wasn't a hard number. I think it's 2,500 people maybe. So maybe it's a little less than that. I don't know, Jason Smorl. I know they were very close to having that sold out, and they should. This is an unbelievable venue. People are going to love it, and it'll be a great place for people to go outdoors and see a game and enjoy the various new amenities.
Could you use future games as possibly a way to get vaccines into arms of people waiting in line to bring Johnson & Johnson?
You could, yeah, you could. I don't know if Dr. Gupta would suggest after you do your shot, you go and have a Thirsty Thursday event, but these are creative things we're going to have to look at moving forward, and it's, you know, and we will. We're open to do it. Our health department's been nimble and mobile, and again, we want to end this thing more than most. So, you know, the best way to do that is to get the shot.
There could be a sober Sunday game.
You could have a sober, yeah, maybe not Thirsty Thursdays, right?
As businesses, whether that be a retailer or a restaurant, trying to get closer to a typical capacity, they also need to have typical staffing levels. And we know that it's been a struggle for some businesses to try to get up to that level because people
Mm-hmm.
they're getting unemployment benefits or getting money some other way, and businesses are having a hard time trying to find people. I'm curious, from your end, do you think that these unemployment benefits, which are left to the last few more months, should they be ending sooner? Should businesses be offering to pay workers more? What do you think needs to happen?
Well, the marketplace is handling the pay issue, right? So I was at Core the other day. I get salads at Core sometimes, and they were paying, I think, up to $18 an hour for someone to go work at Core. And the reason to that, to your point, is a lot of folks are still on unemployment that could be working right now. That's a fact, right? So do I think the federal government should extend the unemployment benefits, the increased benefit? I don't. I do think there's opportunity there. In the hospitality industry, many restaurants are only open 4 days a week still at 75% capacity because they don't have enough staff to go 5 days or 6 days. Because our staff, it doesn't make sense to come back. When we went through our process where we furloughed employees, we tried to bring back employees early, and it didn't make fiscal sense for them to come back early. So we lived with that. So it's a fact, right? So I'm not sure the exact date it ends, but it shouldn't be extended. There's plenty of jobs available, and in this county we have about 2,000 more jobs coming online in September with Amazon.
So do you think that the businesses should raise the amount that they're paying?
They're going to have to compete. They already are. So you don't regulate government. I don't believe government should regulate what people pay their employees. There should be a level of a minimum wage there is in this state, but it's not our job to go in there and say that we're a democracy, capitalism. It's a great thing, but like they have to compete right now. So if you have talent, a talented person working in a warehouse right now, and you're scared about them going to United Auto or Amazon, you're going to pay them so you don't leave because the cost of replacing that employee is a lot. So this is happening right now with wage growth in our economy here locally, which is a very good thing.
Brian, just back to the body cameras for a minute. How does the $600,000 funding level compare with what the sheriff asked for?
Yeah. So in addition to, let's see here, the civil department would have nine personnel, 9 vehicles. The corrections would have a slew of other personnel and vehicles, custody 40 and others. So overall, the sheriff was asking for essentially $954,000 a year to implement everything. I believe we're going to send over $600,000 to get going on everything we've been talking about. Again, this is a new ask for everything else. It needs to be vetted via the legislature.
Given all that's happened over this, are you surprised that you're getting a last-minute ask that's so much different than anything anybody has discussed before?
No, I'm not surprised. No, I'm not. I don't get surprised anymore with things. So again, it's a little minor curveball, but not a big. We'll get. Everybody agrees that we're going to have body cameras for our police department. We're moving forward with that. There's no reason in the world why you would hold up putting body cameras in police officers and their cars. Because the cars were a new ask too, and we agreed. We said, okay, that makes sense. You don't tie one to the other. That's irresponsible. So what we will do is we're not saying no to anything else. We just don't understand it because I don't do this for a living as far as running a jail. So we will send it over to the legislature, let them do their diligence, and let the sheriff's team make the case. And if the legislature thinks that's a good idea, I'll send over an executive initiative. And we'll take it at that way. But yes, it was a little, I had not heard about the concepts of putting these cameras on custody and correction officers. It might be the right thing to do. It might not. The right thing might be that if there's gaps in the technology in those facilities, that we get more cameras in those facilities. That might be cheaper than this.
Is the 600,000 both for the deputy body worn cameras and that same number of vehicle cameras?
The vehicles, 67 vehicles.
And again, 224 road deputies?
Correct.
Who thought body cameras would become such a hot topic?
You never know. You never know what the topic of the week will be, but happy that this is happening.
I know the governor's announcement about new capacity levels there's some complexity to it. For some venues, you can have more people if you have vaccinated people and tested negative people. Is the county going to end up playing a big role in fixing all that?
I believe that's why they called the county executives before he announced it, because like most things in this pandemic, the people who end up implementing the regulations at the state and federal level are us. So again, we really need to understand it, because to where I think you're going, how are we going to regulate it could be a challenge. So again, we'll step up, we'll do our part. If we think some things don't make sense, you'll hear about it.
You mentioned before talking about incentives for young people that you might be announcing to. Can you talk any more about that?
Well,
The vaccine?
yeah, we'll work with the business community. We're already talking to some members of the business community about different incentives ideas. Other people are doing, one of my colleagues out in Erie County did how did he phrase it? A shot and a chaser, yes, yes. So the county executive pulling cars kind of set the stage there. Obviously, we're going to have to do better than what he's doing, but we'll figure that all out. And I know that they'll do different things and get clever and creative. And so we're going through that. We have a team of people that are working on that.
Who's that specifically targeting?
Young people. That's where you look at the data. We'll try. There's hesitancy with 50 to 59-year-old males. They might actually fall into this category well too. And then there's young people. That is it hesitancy, or is it just inconvenience, or they just haven't been able to get it as long. And so certainly anything under 21, some of these promotions aren't going to be acceptable.
Are there any other details, just to clarify, I know it wasn't part of the governor's announcement today, but any residential kind of inside gatherings, do you know if there's any updates?
Yeah, I think outdoors in the homes, there's no limits on capacity. I did not hear, Mary, specifically what he said about inside. Again, this is you can't, it's very difficult to regulate people inside somebody's home, right? I mean, normally you regulate it when you get complaints about large parties, and then you have reason to go deal with it. So that's always been a regulation that has been very, very difficult for us at the local level to deal with. So I didn't hear that piece of it, but I do know as far as your property, having people outdoors, according to the state's regulation now, there is no capacity on that. So I heard that.